So my background, I am the nurse practitioner at the Unattached Care Clinic for Huron Perth. I go to different areas in the Huron County, providing primary care and cancer screening to patients that don't have access to it. I have over 30 years of nursing experience, including emergency interventional radiology and corporate health. And I'll let Alex speak about his background.
My name is Alex Chesnick. So I'm currently a student at Western University, and I currently have 7 years of experience where I'm currently working in Detroit, and have worked elsewhere as well in Wausau and in Detroit as well.
So some of the benefits of cancer screening tests are if you have a test and it comes back normal, it can put your mind at rest knowing that you do not have certain types of cancer. And the other benefit is that you can find cancer early on in the disease, or with some different types of testing, you can easily find things before cancer even settles in. So you might have some early detection of cell changes before cancer starts and have it treated to prevent cancer. If you do have cancer, you can be diagnosed in an earlier stage, which means that you'll have better outcomes and it's easier to treat. And you will have the benefit of having less downtime and less recovery time, and you can have more time enjoying life than being sick and recovering from different types of therapies. And the other thing is it allows you to take ownership of your own health. So some improvements that Ontario has seen since we've implemented the cancer screening programs is that people with cancer are living for a lot longer than before the cancer screening was initiated. Close to 90% of people with breast, prostate, thyroid, and testicular cancers and melanomas between 2016 and 2020 are living at least 5 years after being diagnosed with cancer. 75% of people with cervical cancer and 65% of people with colorectal cancer between 2016 and 2020 are living at least 5 years after diagnosis. And less than 25% of people with pancreatic, esophageal, or liver cancers diagnosed at the same time are living at least 5 years after diagnosis. And for all cancers combined, the mortality rates, which have been adjusted for age in the province, have decreased from the year 1986. At the end of 2020, the number of Ontarians living with cancer diagnosis within the previous 10 years was over 419,000. This is an over 20% increase from a decade earlier. So some people feel that the rates of cancer are rising, but they're actually not. We're getting better at diagnosing them, and people that actually have cancer are living longer. So that's why it looks like that number is much higher than previously.
Right. So what are our statistics we're looking at here? Because we love statistics. So in Canada, our screening rates in 2024 we could do a little better. So only 49% of people between the ages of 50 and 74 have been screened in the last 2 years. So this is something we're going to talk about a little later about how you screen for these different types of cancers. But considering it's only 50%, we can do a lot better. 69% of women between the ages of 25 and 69, that's typically when you'll have pap smears done, had them done within the last 3 years. And then 79%, a little bit better, between 50 and 74 have had a mammogram within the last 3 years.
And our goal is to get that as close to 100% as we can.
Right.
So here's a little picture of the stages of colon cancer for you. As you can see, in stage 1, a tumor is very little. Stage 2, it's a bit bigger. Stage 3 and 4, it's quite big and it extends into the abdominal wall. And this is a nice little visual because if you were to have surgery in stage 1, you could see it would be a very small surgery and it would entail just going in and pulling that little lump out, probably through a keyhole surgery or through a colonoscopy where they can just pull it out with a little snare. Whereas once you get over to stage 3 and stage 4, it's going to be a full abdominal incision and a major surgery to get that out. So that's just one type of cancer. And then for breast cancer, same thing. In the stage 1, it's just a tiny little lump where they would just remove this tiny lump with what would be called a lumpectomy. And in stage 4, you can see that the cancer's moved into the wall of the muscle here. And this would entail removing the entire breast and part of that wall of muscle, as well as reconstructive surgery afterwards. So quite an extensive surgery. So if a patient is being diagnosed by having a mammogram in stage 1, which is this person likely cannot palpate this lump at this stage because it's virtually unfeelable. You wouldn't be able to feel a lump until you're into the T2 or T3 size. So having this diagnosed early is definitely of a better survival rate and definitely of a better surgical outcome.
So Sue, what about spreading? So I know people say obviously cancers can spread to different parts of the body, but would like a T1 or a T4 spread more easily?
A T4 would definitely spread more easily because it's invading close to the lymph nodes here, whereas you can see in T1, it's not anywhere close to the lymph nodes. So it's less likely to spread in an early stage.
Gotcha. So next we'll talk about some cancer risk factors. So some are modifiable and some are non-modifiable. So it's just to kind of put those in different words. So things we can control and things that have kind of been already controlled for us. So things like our age, our family history and genetics, and our sex are things we can't control. But other things like our lifestyle choices and weights, exposures, and vaccinations, those might be more things that we're able to kind of modify in our lifestyle and kind of help with our cancer risk.
So non-modifiable risk factors. We can't change our age, unfortunately, and every year that we get older puts us at an increased risk of our DNA changing within our body and cancer starting. And that's why as we get older, regular screening is so important to us.
Mm-hmm.
Family history. We have shared genetics with our family that puts us at high risk. If we have a family member, a first degree relative, perhaps that had colon cancer, or a first degree relative that had breast cancer, it would put us at higher risk for some of those cancers because some of the genetic imprints from our family members are imprinted on us. But outside of genetics, some families drink from the same well, they eat the same food, they live the same lifestyles, and that puts them at increased risk in a different way. And because of a first degree relative having a diagnosis of cancer, it makes for different screening recommendations. And we're going to talk about that in a little bit when we go through the screening. So for sex, men are at increased risk for prostate, lung, and colorectal cancers, and women are at risk for breast, lung, colorectal, and cervical cancer. Some modifiable factors that we can change are diets that are high in leafy green vegetables and fruits, and low in saturated fats and red meats are better for cancer prevention. Getting 30 minutes of physical activity per day, at least 5 days a week, is good for cancer protection. And recent studies have shown that unfortunately no amount of alcohol is good for cancer prevention. So meaning that every glass you drink puts you at higher risk for cancer. Zero smoking is acceptable for cancer. Cancer is fed on cigarette smoke and tobacco, and that includes also marijuana or other smoke exposures like campfires, breathing in the air and stuff. Sun exposure, the UVA, UVB lights put you at risk for skin cancer. And maintaining a healthy weight puts you at, it protects you by maintaining a healthy weight. as well as, it's not on the slide, but increased sex partners puts you at risk for cervical cancer due to HPV. Also, when we're coming back to obesity, obesity puts you at risk of so many types of cancers. Having a healthy body weight will decrease your risk of 13 different cancers. Thyroid, breast, liver, pancreatic, gallbladder, uterine, ovarian, colorectal, kidney, multiple myeloma, esophageal, and meningioma cancers are all directly related to obesity.
So some other things we can talk about too are exposures. So different things depending on where you work, where you live, you might be exposed to. So Sue, didn't you work in interventional radiology? Would that put you at higher risk?
Yeah, being exposed to radiation does put you at high risk, but wearing personal protective gear like lead, like we wore in the interventional radiology department, helps mitigate some of that risk.
Good. And then I used to work at a plant, an automotive plant, and they would have some gases we would use to kind of wipe off sealer. There, they would provide us with masks that we would actually use to breathe when we were doing that job. So that's another way PPE can help prevent those exposures. And different things like dust and smoke. So if you live with someone who smokes cigarettes, obviously you've heard before that secondhand smoke is worse than the firsthand smoke of someone smoking cigarettes. And then dust as well. So depending on your job, if you work in drywall, if you work in a mine, those things can also increase your risk for certain types of cancer like lung.
And I think it's important that now that we know that some of these things cause risk, if we take proper steps to protect ourselves using proper PPE, that can help mitigate that risk.
Mm-hmm.
So some of the screening tests available in Ontario for cancer are having a mammogram for breast cancer, a FIT test, which is basically a poop on a stick test for colorectal cancer, a CT scan of the lung, which is a very low dose of radiation. It's not a full CT to check for lung cancer, and cervical screening, which is a pap smear for it now has changed from looking at cells under the microscope to looking for the HPV virus, which causes cervical cancer. And we're going to go through these 4 tests with you in just a minute.
Yeah, so the first one is cervical cancer screening. So what does that look like? So if anyone who's had one, it's a pap smear. And it's provided by or performed by a trained provider. And it's using a small brush that's used to collect cells from the cervix. So when we're testing those cells, they can actually test for HPV, like Sue said, and then cell changes as well. So who would get a pap smear done is a woman or anyone with a cervix, really, and if they've had any sexual contact in the past. And then, so these are going to be performed every 3 to 5 years from the ages of 25 to 69. And typically, some people will have them continue a little bit longer. So that's if they weren't screened towards the end of their 60s, if they're immunocompromised, or if they've had a previous positive test, so an abnormal pap smear. Sometimes people will get those performed a few more years. And then we're hoping soon that self-screening for HPV will be available as an option to kind of eliminate the need to have to come in to do that screening.
Yeah, in British Columbia, they're actually doing self-screening. Did you know that? And the way we know the difference between whether or not you need it every 3 years or every 5 years is if you've had a normal pap, then it's every 5 years if you're not on any immune suppressive therapy. So, Alex, can you tell us what some immune suppressive therapy might be?
Yeah, so typically those are cancer treatments. Sometimes if you have diseases like asthma, rheumatoid arthritis, sometimes medications can actually suppress your immune system. Or if you've had a previous organ transplant, so people who have had kidneys, lungs, they're put on continuous therapy that help to suppress their immune system, and so that those organs don't actually get rejected in their body. So some of those things can actually put you at a little bit higher risk.
That's great. And the best way to know if you're on those therapies is to talk to your healthcare professional about it.
Right.
So breast screening is a mammogram, And I feel like mammograms have had such a bad rap. I was so terrified to have my first mammogram because I'd heard so many different women complaining about how bad the squish is. And when I actually went for a mammogram and I was finished, I was, oh my goodness, I said, like, that is so easy. And it was not painful at all. Basically, what it is it's just like a little shelf that comes down and it compresses your breast in there. Um, for about 10 seconds. They take a picture and then they switch the sandwiching of the shelves to a different position and take another picture. The person taking the pictures has a look at the pictures to make sure that they've got some good film in there. And if they're okay, they send you on your way. The radiologist will read it and send a report to your doctor or nurse practitioner. And from there, they will tell you how often you need to come back. We start screening at age 40, and you can self-refer to any hospital under the Ontario Breast Screening Program to get a mammogram done. If you're asymptomatic. If you're having symptoms of breast pain or you find a lump or some changes in the breast, you need a referral from your healthcare provider. If you're at increased risk, which would mean that if you have a first-degree relative that had breast cancer, you need to have your first mammogram 10 years before that person was diagnosed with cancer. So, for example, if my mother had breast cancer at age 40, I would need my first mammogram at age 30. So here's some myths versus facts. Some people think that finding a lump in their breast indicates breast cancer, when indeed not all breast lumps are cancer. In fact, most are not. Some people get worried when they get called back for second views for a mammogram, and sometimes that's just because part of the breast wasn't seen properly, or they see a little bit of a lump and they're not sure whether or not it's a swollen milk duct or some other normal variant that is not cancerous. Some people think that squishing the breast in the mammogram can spread the cancer seeds, and that is not the case at all. You cannot spread cancer by having a mammogram done at all. And some people think that only women can get breast cancer, and that's also a myth because I actually have two patients in the Unattached Care Clinic that I see that are male that have breast cancer. So we'll talk a little bit about the colon cancer screening for low-risk patients. Like I said before, it's called a FIT test, which stands for fecal immunochemical test. And what it does is it looks for hidden blood, which is called occult blood, in the stool. It's a simple test that you see your primary care provider and they will order one for you. It gets delivered to you in the mail and it comes with a little set of instructions in it. It's a little container with like a little popsicle stick inside of a little container. You basically poop into like a little bag, collect it with the popsicle stick, pop it into the container, and you put that poop in the mail. If it's negative, you do it every 2 years. If it's positive, then you have to have a colonoscopy after that, unfortunately. But they're good to get, and they're done between the ages of 50 and 74. But a fairly simple, non-invasive test. For people with increased risk, and that would be somebody who has a first-degree relative with colon cancer, they would have it done 10 years earlier than the age of that person who was diagnosed with colon cancer. So same as the breast screening scenario, if my father had colon cancer at age 50, I would start doing a colonoscopy at age 40. And it's also done for other people with certain underlying conditions like inflammatory bowel diseases. They would move to a colonoscopy instead of a FIT test. And they determine how often you need them based on what they see inside. And the added benefit to a colonoscopy is that it's preventative. So if they get inside there and they find that you have a polyp, they can remove that polyp before it turns cancerous. Some patients with inflammatory bowel disease have several different polyps in there, and they can have them all removed at the same time as the colonoscopy and actually prevent cancer from growing. And usually it's between 3, 5, and 10 years, depending on risk factors and what they see, and a combined conversation between the surgeon and the patient. So lung cancer screening, this is for people who were either former smokers or current smokers, and they smoked a 20-pack year of smoking. So the years don't have to be consecutive. So you could have smoked for 10 years between the ages of 18 and 28, quit for 5 years, and then smoked for another 10 years, and you're still eligible for the screening. It's a very low dose CT, so you're not being exposed to a lot of radiation. And it's just like having a picture taken. It's very non-invasive, and it's more clearly visualized than a chest X-ray. And what would happen is your nurse practitioner or your doctor would send a referral in. The screening team would look at that referral and they'd bring you in for that initial picture, and then they will bring you back every year for 3 consecutive years. If they notice any abnormal nodules, then you'll have more close follow-up, and some of those follow-up CTs might be between 6 and 12 months. So we're going to talk a little bit about how to access screening. In Goderich, you can call the Goderich Hospital or the Ontario Breast Screening Program to book it for a mammogram. But some of the other areas like Exeter, same thing, you can call the Exeter Hospital. And you can call any hospital that has a mammogram and book a mammogram under the Ontario Breast Screening Program. For cervical cancer screening, you can book with your family doctor, your nurse practitioner, or a public health clinic or the sexual health clinic. You can call 811 to book that. The FIT test will be mailed to your house after an appointment with your doctor or nurse practitioner. Lung screening, you need an appointment with your doctor or nurse practitioner to fill out a request for a low-dose CT, and it's only done at London Health Science Centre or a big hospital like Toronto. If you have symptoms, don't wait for your screening test to be eligible for your screening test. See your doctor or nurse practitioner right away. These screening tests are only for people that are asymptomatic.
So if you're one of those people, the statistics that hasn't gotten their screening done, take a picture of this or screenshot it and get it done, okay? I'll give you a second there.
If you don't have a family doctor or nurse practitioner, you can come visit me or one of my colleagues. And we'd like everybody to take a screenshot of this for their family members that may not have primary care providers. We have unattached clinics in Stratford, Listowel, Wingham area, in Zurich, Goderich, and Exeter. And you can just call and book an appointment to get that screening stuff done. We'll give you a minute if you want to take a screenshot of that.
So does that mean if I don't have a family doctor right now, I can call you?
Absolutely.
Okay.
And we're going to go through some tips to prevent cancer.
Yeah, so obviously we went through these a little bit earlier, but just to kind of go through them in a little bit more detail. So what does a good diet look like? So there's a couple recommendations out there. Obviously following Canada's food guide. I don't know if you've seen it, but it's the plate. So it has vegetables on one half and then protein sources and carbohydrates kind of splitting up the other half. So that's one good resource, as well as other diets called the DASH diet or the Mediterranean diet. So those are typically focusing on whole foods, healthy fats like olive oil and fish, and whole grain carbohydrates. Then next, moving on to exercise. So Canada recommendations are somewhere between 150 to 180 minutes of exercise every week. So whether you get that in 2, 3 days or 7 days, it doesn't matter. And whatever exercise you enjoy is the best exercise, the one that you're going to do. So if that's aquafit with Sue, or if that's walking around the track at your local school, anything that you can get to get moving out there. Alcohol, like Sue had said earlier, we recommend anywhere under 2, but again, no amount of alcohol, what we're finding is safe. So 2 drinks of beer is what we used to say would be an adequate amount or a safe amount of alcohol every day. But now we're recommending just abstaining completely from it, just because it does put you at higher risk for esophageal, liver, and stomach cancers specifically. Smoking, so if you haven't quit yet or you're still working on it, we encourage you. And obviously, if you need help with that, you can reach out to us. But obviously, some things to kind of help you with that are Nicorette gum or the patches that you can put on your arm that can help kind of reduce those cravings for smoking. Sun exposure. So the biggest one is in the summer times, obviously not now when it's gloomy and there's not much sun out there. But in the summertime, the hours between 11 and 3 are particularly high sun exposure risk. So when you're going out during those times in the summer, it's important that you cover up either with a hat to cover your face or putting on sunblock. Those are some very useful things that can help prevent skin cancer from happening. And then finally, weight as well. So getting to a healthy BMI. So there are different things you can look up online to kind of calculate your BMI, and basically it just takes into account your height and your weight together. And any BMI between 19 to 25 is healthy. So we're trying to target that either through weight loss, diet, exercise, and obviously speaking with your healthcare provider and how they can give you tips for that.
So tips to prevent cancer. The HPV vaccination is great for preventing HPV, which is the virus that causes cervical cancer. But this is not just for women with cervixes, it's also for men. A lot of the oral head and neck cancers are caused by HPV virus as well. Someone famous that we know, Michael Douglas, his cancer is caused by HPV. He's got throat cancer. A great deal of throat and oral cancers are actually caused by the HPV virus. Knowing your genetic risk factors, there's some different genetic variations called BRCA1, BRCA2. They're common in people with ovarian and breast cancers. So if you have a family member that has tested positive for BRCA1 or BRCA2, you might want to consider getting genetic testing done to know if you have that gene. And if you do, then you would be monitored much more closely than somebody that does not. And you might be offered some preventative treatment as well. Knowing your exposures, whether it's occupational or environmental, your lifestyle, obviously minimizing radiation exposure. When you go to the dentist, make sure that when you have your x-rays done, you're wearing a lead apron to cover up areas that could be affected by radiation. Following screening recommendations so that you know you're clear, or you might have some precursors to cancers that could be changed, or an early stage cancer that could be easily treated. And monitoring your symptoms and knowing your body. So if you do a monthly self-breast exam and you notice something's off, get in right away to your healthcare provider and get that checked out. Knowing what your moles look like on your arms and legs and everywhere else on your body. And if you notice anything changing, having it checked out right away. Same with your bowel movements. If you notice a change in your bowel habits, get it checked out. The best way to know if anything is changing is to pay attention to your body and get any changes looked at right away. There is a risk calculator you can go at, which is www.mycancerriq.ca. And you can type in your own personal information and it will show you what your cancer risk is and what you can do to mitigate some of that and investigate for it. And our take home for today is that screening is super important, and we want to encourage each and every one of you to get screened for whatever you're eligible for, and for you to go home and have a conversation with your parents, your spouse, your brothers and sisters, and tell them all to get screened, because early detection leads to better outcomes. And taking control of your health. Alex, can you tell us, because you're a student, what are they teaching you in school now about patients taking control of their health?
Yeah, so the number one thing that we're being taught right now is having your patients kind of take charge of their own health. So these screening things, your doctors might not remember, or they sometimes the screening pop-ups don't always happen, or they get too busy. So if you know you're due for a screening, let us know, and we'll get you booked in for it. And like Sue said too, taking control of your health through your diet, your exercise, making sure you're covering up in the sun. These things are important and are going to help you kind of reduce your overall risk for these different types of cancer.
Thank you, Alex. So we'll take some questions if anyone has any questions for us.
It looks like we do have one that did come in during your presentation.
Okay.
One of the attendees said they were a fair-skinned child in the 1960s, frequently pretty sunburnt, red, blistered, peeling. As an adult, they have been diligent about sunscreen and covering up with clothes. They have no visible skin abnormalities. Do these early burns impact the risk of developing skin cancer?
Unfortunately, any burn that has blistered and peeled does put you at increased risk for skin cancer. But having that knowledge that you are at increased risk, hopefully will make you hyper vigilant about checking your skin on a regular basis, looking for any changes. And there's what's called the ABCDs of skin cancer. You're looking for asymmetry in a mole. You're looking if it's black or dark or changing colors. And if it's growing. So if you notice any changes to your skin, you're going to want to have that looked at right away. And knowing that you were burnt as a child is a good thing to keep in the back of your mind, so that you're more careful about examining yourself.
Thank you, Sue. I think that was a pretty good answer to that one there. I just wanted to thank you both for sharing your perspectives as current and prospective healthcare professionals working in a real space. I know we had the one question. If anyone else has any questions, feel free to add them to the question and answer box below. And either Alex or Sue will be able to answer them today for you. These don't have to be something that was addressed today. If you have any questions about their work as individual practitioners, any questions at all for them, feel free to add those in the question and answer box. I did have a question for you. So after looking at a bunch of different research concerning screening, especially in rural areas, it seems like it has been a big issue to try and get people to come in. I know I noticed cervical cancer numbers for screening have been decreasing in terms of participation. As a worker working in rural Ontario, what have you noticed maybe from patients or from your work in different fields? What has been the barriers that have prevented, you think, people from coming out and accessing this publicly available screening?
I think some of the barriers are accessibility, for sure. A lot of people in this area have been on huge wait lists for family doctors that are 5, 6 years long, and they're unable to get into a family doctor. That's why we sort of set up the Unattached Care Clinic to deal with some of that stuff, as well as a lot of people in rural Ontario work on farms, or they work in factories or big plants that work long hours, and it's hard for them to take time off to get out and get their screening done. So we're trying to set up clinics in different areas so that it's not so far for them to travel to be able to access some of that stuff. Do you have anything to add to that?
No, I think that's the main thing is, we're trying to get more primary care providers so that we can get those screenings done for you and get more people rostered on to either a clinic, a family health team, or a physician, or seeing us as nurse practitioners. So we're hoping in the next little bit we get more of us out there and more people attached to us looking after your care.
Have you noticed, well, I've got a couple of questions that I have from the audience that I'll address in a moment. But in terms of unattached care, is there any difference in the cancer screening or anything that you provide related to cancer that's different from a primary traditional care setting, or is it mostly?
No, it's all the exact same stuff. Only the one thing I can say is that I've done 1 million pap smears in my lifetime, so I've got it down to a fine science. It's quick and painless, as most patients would tell you. And then the added benefit of coming to us is once you get picked up by a care provider in Huron, Perth, we transfer your file over to your new doctor free of charge, and all that background information goes with you. So you don't have to worry about having your records transferred. You don't have to pay for them or anything. It's sort of like having a record that follows you.
Oh, that's amazing. I didn't know that it was so easy to get that all set up.
Yeah, it's pretty seamless.
Yeah, no, that's good. That's what we need in our healthcare system. So that's exciting. Someone did ask, so in terms, I'm not sure if you'll know for this one, but they mentioned GLP-1s and the fact that some people may be prescribed or may consider taking those for weight loss. They were wondering if beyond that weight loss that's attributed to GLP-1s, are there any other protective benefits related to GLP-1s and cancer prevention? Is there any?
Well, it's more cardio protective and renal protective,
Okay.
as well as helping prevent Alzheimer's disease. They're great drugs. I love them. I think that the benefit with reducing cancer comes from the loss of weight. As we saw in that previous slide, 13 different cancers are caused by obesity. And by having your weight brought down, you're reducing the risk of those cancers. They do have a small increased risk of thyroid cancer and pancreatic cancer for people that are genetically predisposed to those kind of cancers. But most of the benefit comes from the cardiovascular system, renal system, and brain, which are all small vessels that it helps protect those vessels.
Okay.
They're also they're pretty new medications too, so a lot of times it's hard to see those direct effects right away. It takes trials, studies through years and years, but they follow people to kind of see the associated risks and benefits. So in the sense of looking at your lowering your risk of cancer, we might eventually find out that they reduce the risk for certain types of cancer. But as of right now, just mainly the weight loss is the biggest thing that they kind of help with.
Yeah. Yeah. It seems like for something like that, the best course of action is to consult with your provider and look at the current risks, look at the current research, and just go from there, decide whether that's something you'd be interested in taking. We had a couple others come in as well. So someone has asked, do you have any tips about what not to believe for cancer and screening, especially when scrolling on social media? Because sometimes they were saying there's some bizarre claims. How do you know what's true? How do you know what's false? Where should you look to see if information is valid?
Yeah, that's a great question. And we actually talked to a patient about that this morning. You have to consider the source of where it's coming from. If somebody is a bathroom keyboard warrior and they're just typing up information that they're coming up with, probably not the best source. But if you're seeing something come from Cancer Care Ontario, the Canadian Cancer Society, the Ontario Medical Association, the Nurse Practitioner Association of Ontario, Health Canada, those are all reliable sources. So you really have to sift through what you believe and what you don't believe. And that's not just when it comes to cancer care. Like we tell our pregnant patients, same thing with pregnancy. It's actually part of the prenatal screening questionnaire to consider where they're getting their sources from. It's like that even with whether it's healthcare related or not. You could get stock market investing information from somebody that you meet on the street and lose all your money. And you'd probably realize it a lot faster than you would lose your health. But same idea, like you really have to consider the source.
Yeah, yeah, it definitely does apply to a lot of different areas in life. Always double check. Is there
Yeah.
anyone in particular they should be looking if they're looking for kind of research or studies related to cancer, or should they mostly like is that something, is there a specific website or area that they could find where it's
Yeah,
helpful?
Health Canada is great because it sort of encompasses all the provinces. Or the Ontario Cancer Screening Program. You could look up the Ontario guidelines there.
Thank you, Sue.
You're welcome.
We do have another one here. Someone is asking about metabolic issues such as prediabetes, fatty liver, and whether those affect cancer development or the need for more cancer screening.
Prediabetes and fatty liver, they put you at higher risk for cardiovascular disease more and cancer as far as the excess weight that presumably people with fatty liver would be carrying around. And if somebody does have a fatty liver and prediabetes, there's a great online program that's covered by OHIP called Lifestyle RX. They actually reverse prediabetes and it's fully covered by OHIP. And they also clear out a fatty liver. They have specialists that only deal with fatty liver and prediabetes. And there's a special equation that they use between your body measurements and a bunch of blood tests that are done that looks at your pancreatic beta cells. And they will tell you a goal weight to achieve through diet and lifestyle changes to take away the fat from the liver. And once that fat is gone from the liver, unfortunately, once your liver gets backed up, it becomes like a one-way gate for fat. Like you keep gaining weight, but you're not able to lose weight until your liver is cleared out first. And a lot of health food stores are selling people liver detox and stuff like that, but nothing really works except for losing the fat. So they'll tell you what your personal fat threshold is, and they will have a dietitian and an internal medicine specialist work with you until you get to that goal weight. And that takes away your risk of fatty liver and prediabetes. So Lifestyle RX, highly recommend the program.
And I will try and drop a link for that one near the end of the lecture if people are looking to do a little bit more reading into that. We have a lot of questions coming in. So are people attending unattached care clinics being referred to local community support services for wellness and exercise classes if they would benefit from these resources?
Yes. We do have community support services like counseling that's free available to some of our patients. And we do have, for anyone age 55 or over, we have a free referral service to day programs where they can do exercise, eat a healthy hot meal, do crafts and social integration with other people, as well as physio. We refer to diabetes specialists in the area. We refer to all the same people basically that a primary care provider would.
It makes me happy to hear that the unattached care clinics have so much access to everything, because I did a little bit of reading a while ago, and it's somewhere around 65,000 people within the Huron Perth Bruce without a family provider. So it's incredible that we have access to these facilities, especially in our area through Goderich, CERH, and Exeter. Someone was asking about Lifestyle RX. How does one access Lifestyle RX? Do you need a referral?
No referral. You can go online and self-refer. And they will do an intake with you. And after the intake, they start you on a 12-week program where you attend group classes by Zoom. You pick a time that works for you, and then you have one-on-one appointments with the internal medicine specialist at I think it's like 2 weeks into the program, and then again at 3 months into the program, and then when you're done, and then for a year and a half afterwards, every 3 months.
Good to know. I hope that answers the question there. I had a question. Oh, there we go. We've got the link in the chat there as well. I saw that nurse practitioners starting April 1st are able to bill OHIP, which is really exciting for that line of work. Does that have any impact at all on cancer screening and how that process goes through? Is it mostly just an administration change?
So as of right now, that's the plan is for April 1st.
Okay.
We haven't heard anything yet. They're still kind of trying to knead out the details of what that's going to look like.
Okay.
There's rumors that it might get pushed back just because they're really meeting this deadline. It's February 10th today, and we still haven't heard much about it. Neither has the governing body, the NPAO. They haven't heard too much information. So we're hoping for then, but it's looking like it might be a little later than April.
And
Okay.
not every nurse practitioner wants to bill OHIP either. Some of us like the luxury of a salary and being able to spend time doing more than one thing with a patient at a time.
Yeah, it'll be interesting to see how it all pans out.
Yeah, because some of my people come in, they haven't had a care provider for a decade, and I can't really tell them that they can only address one thing today because they have about 8 to 10 things that are very pressing that need to be taken care of.
Yeah. Yeah, hopefully that the changes don't take away from that would be the hope for something like that.
Mm-hmm.
Do we have any more questions coming in from the audience? Do you have any big take home? I know you addressed near the end of the presentation kind of the take homes. Is there one single message that you would like people to know about something maybe that would lessen their anxiety or relating to cancer screening that you think is important that people take home from all of this?
I just think it's really easy to do, and it's not painful. Not painful, not invasive. And it's something that we're lucky in Canada that this is offered to us. Like people in third world countries are literally dying because they don't have access to it. And it's something we pay for with our taxes. So we should all take advantage of it because it's like anything. If you don't use it, you might lose it. So I think we should try to protect what's our right here and exercise our right to good health.
Thank you, Sue. Yeah, that's really powerful. I like that. Yeah, because it is something that we are paying for already, and there really isn't a downside. Most of them are so minimally invasive and so, you're right, easy to go through that if you have the time, if you can make that little bit of time, then you should definitely be going about it because it's just so beneficial. Detecting things early as opposed to late can have a huge impact on your treatment plan. So definitely, yeah, as Michelle is saying, be an advocate for your own health. Make sure you take charge and address issues as they come up, even before. Make sure you're getting that screening.
Yeah.
I think that's all from me and from the audience. So I think I'm going to start with some thank yous here. Obviously, thank you so much to both of you, Sue and Alex, for coming out today, for sharing your perspectives. I mean, we really, really appreciate the knowledge that you provided for everyone today. I also wanted to thank everyone in the audience for coming out, whether you're joining in through Zoom. I know we're on Hurontel as well today, so anyone who's watching from there, thank you for coming on out. I hope that you all gained some knowledge into cancer screening awareness, and if you have any more questions, you can definitely reach out to us at Gateway Center of Excellence in Rural Health, or follow up with your provider if you'd like to know more. I also wanted to thank, we've got a couple of great sponsors who help make our lecture series possible. Without them, we wouldn't have the funding or support to continue through. And that's CIBC Wealth Management, DeJager Town Square IDA Pharmacy, Hurontel, who's broadcasting this live right now, Lighthouse Money Management, McEwen and Keegan Insurance, Zehrs Goderich, and also Libro Credit Union, where this lecture is being hosted from today. So Gateway Center of Excellence, we are a not-for-profit organization with charitable status. and we greatly appreciate and welcome any support that we receive. As an acknowledgement, we help deliver the Discovery Healthcare Camp in partnership with the Schulich School of Medicine and the Huron Health System. And that is actually, registration is opening at the beginning of March. So if you have anyone in your family, grandkids, extended family who either is interested in healthcare or doesn't know they're interested but wants to learn more, that's being offered July 6th to 10th in Goderich and July 13th to 17th in Stratford. And again, registration is opening up in March, so we encourage you all to come and join. If you don't know what Discovery Healthcare Camp is, it is basically, there's sessions with practical skills. There is also, you learn a little bit about the pathways to becoming different healthcare providers. And it's all provided by local healthcare providers that come out and deliver these sessions. So it's a week-long day camp, and you get a host of anything from a geriatrician to EMS to social work. So it's really beneficial for people looking to explore the field. We also, this was a bonus lecture, but our next scheduled lecture will be coming up in March, on March 3rd. So that one there is Bridging the Distance, Transportation Challenges and Solutions in Rural Regions. And that will be brought to you by a couple of rural transportation experts, including Dr. Sarah Patricia Breen, OneCare in the County of Bray. There's also a poll on screen. So anyone who attended today is welcome to fill out this poll. Just a little bit about future webinars, current webinars, any feedback you'd have. That's on the screen there for anyone on. And once again, a big thank you to everyone today, to Alex and Sue, to everyone who joined in. I hope you all have a wonderful rest of your day, and take care. Enjoy yourselves.